the same person with the same experience can do a better job with a robotic system. This is our robotic system. Da Vinci surgical system is the only FDA approved surgical system right now. There are more companies coming in. What it provides is a three-dimensional high-definition vision to the surgeon, fluid and ergonomic movement. So laparoscopy provides the surgeon with a different kind of feel. It would, it is a counterintuitive movement. So if I have to move my instrument tip to the right, I have to move my hand to the left. But in robotics, it's an intuitive motion. So whatever way I am moving my hand as I am doing in open surgery, it is going to translate equally well in the same direction. If I am to do a spine job, like if I am switching on aorta, in a robotic system, I can do a fine setting of 5:1. So what that would mean is, if I am moving my hand by 5 centimeters, the tip of instrument is just moving by 1 centimeter. So even if the surgeon is not, trained into very fine techniques, the robotic system can help surgeon do a better job. These are the instruments, endo-wristed instruments with 7 degrees of freedom. These are more like human wrist rather than straight sticks, which we use in laparoscopy. And this is how a robotic system is docked onto the patient. So these advantages I discussed with you: scaling of motion, filtering out tremors, and it has the potential to complete the most daunting procedures. There are some limitations also. Right now there is no tactile feedback. It's a bulky and costly equipment, and there is obviously a learning curve. But with time, more and more companies are coming into it, and the technology is getting better. So I did my fellowship in Robotic GI and Bariatric from University of Illinois at Chicago in 2013. And I have been performing robotic surgery since 2012. So I also worked as a faculty member in Duke University. And I have been fortunate enough to do more than 500 robotic procedures and more than 300, that include more than 300 robotic bariatric procedures, with a lot of publications as well as training courses held for surgeons from all across the world. So why do we think about robotic bariatric surgery? It's not a problem you see very commonly in Himachal, but I suppose I get so many patients from Himachal also now. This is the kind of excess baggage which people are carrying onto themselves. And why so? Because this is how we exercise. Most of us have treadmills at our home, but they are lying vacant and our dogs are using it, and we are just watching TV and snacking. While even if you have to walk the dog, you'll just go into a car and the dog is walking by the side. And this is not something which you don't see now, you see it routinely. And if you go to a fitness center, you don't take the stairs, you go by escalators. In our hospitals, we take lifts routinely, even as medical and healthcare professionals. So all this is leading, along with the diet habits, to morbid obesity and super obesity. And when you operate on a super obese individual, there are a lot of challenges there. There is enlarged liver, limited working space, there is excessive torque. The abdominal wall is this thick, this is 10 to 12 centimeter thick abdominal wall. These are the kind of abdomens we see with lipodystrophy after insulin. And this is not a guy who is pulling a rickshaw. He drives a Mercedes every day too. And his daughter tells him, "Papa, don't come to school with me. People make fun of me. Leave me outside the school 50 meters away and I'll walk to school." So, and this is not just high socioeconomic strata. This is a butcher from Jama Masjid area, and you can see the abdominal wall. What kind of abdomens are we dealing? So, and this is not just aged people. This is young. This guy, this child, in 10th class, 152 kilograms. And what is it leading to? It is leading to this kind of situation. BMI of 85, 200 kilos. Patient arrested in casualty, on ventilator. There is no way she can be extubated. We had to take this kind of patient for robotic bariatric in our OT on ventilator, and she's like 5 years down the lane now. She's 75 kgs, taking care of family. Otherwise, there was no reason she could come out. And same 85 BMI male. This is a 33-year-old person who has not been out of his home for last 10 years. So you don't see these people walking on the street, because after they cross 150 kgs, they just don't get out of their homes. These are some technical details of how we do robotic surgery. I will not go into this, but this is a photograph which would show you how a robot is docked in the OT, and this is the robotic system which has been docked, and the robotic surgery is in progress. And beautiful results come after surgery. This is how patients gain their life back. The diabetes goes away, hypertension goes away. This is a big industrialist from Haryana. and he just recently went to Kedarnath and did all the trekking. This from 140 to 78 kgs. So these are life-changing stories. But we have also published our experience across international PubMed Index journals, and it has been cited more than 100 times now. I have been fortunate enough to work with leaders across the world, and I think we are able to provide the best quality service available anywhere at 1/10 the cost if we compare it from US. So these are some of the educational initiatives. I would invite all the surgeons who are sitting here who are interested to come over to our conferences and to come over in person, visit us for a week or two and just see what it is, because seeing is believing. So, and what is new in robotics? So why should we be excited about robotics? You know, GPS, it changed the way, Google Maps, it has changed the way we drive. So now nobody asks Panwala, where is the shop? Everybody just comes on to Google Maps. This is what robotic system is going to give us. If I am going to cut common bile duct in a laparoscopic cholecystectomy or robotic cholecystectomy, it is going to tell us, no, you are going to cut CBD, stop. So there is a warning message, and this is real, this is not future, this is present. There are warning systems, there is GPS of surgery, there is artificial intelligence coming up, which would guide the surgeon. You are going to divide pulmonary artery, just be careful. And if you want to go ahead, you can definitely overcome that warning, but at least you get a warning. So here is ICG cholangiography. It is not just bariatric, but as simple as cholecystectomy. It can save a lot of CVD injuries. You see here, this is the gallbladder, and it lights up the CVD as soon as we switch on ICG. This is the CVD which we have to save, and here in this video you can see that after dissection, also before clipping, you see this is CVD. And here it has been, robotic system is showing us that you have basically divided the right hepatic duct rather than the cystic duct. So these are, I think, some things. Here you can define the course of splenic artery, which is something very difficult in tumors to identify. Sometimes the pancreatic tumors would engulf it. So it lights up green. So this is ICG fluorescence, which is lighting the splenic artery, and then the spleen will light up. So you can easily see where your major vessels are. These are the future applications. I think I just told you this is something which is going to come very recently now. It has memory, it has a lot of miniaturization. But see, because of shortage of time, I will not go into details. But the overall future may look something like this, with no surgeon inside, and surgeon is sitting somewhere in the comfort of his drawing room and doing the surgery and guiding through the robot. And this is how a new innovation is adopted. So any new innovation is adopted by early adopters, which are just 13.5%. Most of the people are, in the majority which adopt it late, and there are some laggards who would never adopt a new technology. So let us be early adopters rather than laggards or late majority. It is safe, it is effective. I think that is it, and I would like to answer any questions if you have. Thank you very much. Thank you very much. Yeah, so the cost of robotic equipment is 15 crores, and the cost